In this video, we'll discuss about Rntcp, Revised National Tuberculosis Control Program, one of the National Health Program. First, see the history of that program. In the year of 1962, the program started at Ntcp. Ntcp stand for National Tuberculosis Control Program. Later on, it is revised as a Rntcp, Revised National Tuberculosis Control Program, in the year of 1992. First phase started at 1997. What is the new initiative in this Rntcp means they introduce a dot therapy. What is a dot? Direct observation, treatment, supervision. So in this they will give treatment or tablet to the directly to the patient and will observe. Under this supervision of registered practitioner or any doctor or nurses. So under the supervision of these people only patient will take this medication. That is the new initiative in the Rntcp. At present, we have another strategic plan for the tuberculosis elimination. It was a recent trend in the Rntcp program. What is the recent trend means? Strategic plan for tuberculosis elimination. It was started in the year of 2017 under the Prime Minister of Narendra Modi. So he want to eliminate the tuberculosis from India by the year of 2025. We have eliminated or eradicated tuberculosis from India. Rntcp, it is the one of the National Health Program. Dot therapy, direct observation, treatment, supervision. For that, Indian government has started program that is called strategic plan for the elimination for that official in the year of 2020. So they are renamed again Rntcp to National Tuberculosis Elimination Program in the year of 2020. They renamed this program Rntcp to National Tuberculosis Elimination Program. So what are the new initiatives in this program? Means what are the strategies for this National Tuberculosis Elimination Program? First one is active case finding. So strategy number 1, active case finding. How to find the active cases to reach the unreached places like slum, tribal areas and hilly areas. And how to find the active detection of how you detect by active diagnosis. For that they implemented new diagnostic technique like X-ray, CBNAT. CBNAT stands for cartridge based nucleic acid amplification test. So implemented chest X-ray for the diagnosis of new cases and implemented CBNAT test. Previously we used to rely the tuberculosis detection sputum culture sputum culture and acid pass staining used to detect Mycobacterium tuberculosis. Second strategy, need to focus on the tuberculosis comorbidity, like mainly focusing only HIV and diabetes mellitus. Estimate number of death officially classified as caused by tuberculosis among HIV negative in the year of 2021, 1.4 million death. Only tuberculosis not affected in HIV. This one is doubling number. HIV along with tuberculosis, 0.65 million people died. Third next strategy, private sector engagement. Now involving the private sector also to find out the cases. If any patient is going undertaking the treatment in the private sector, the private sector people has to notify that cases to the government. That is the notifying cases. If the any patient is taking a treatment or buying a tablet from the private pharmacy, they have to notify to the government through a separate portal, that is connection portal, that is called notifying. For that person, for that reason we have enhancing the private sector also. Another strategy, drug resistant tuberculosis. Were focusing on the drug resistant tuberculosis, multi-drug resistant tuberculosis. Further reason, we have Indian government has started 2 new drugs for the treating drug resistant tuberculosis, that is called beta quiline and dilamanate. So beta quiline and dilamanate, these two drugs are resistant to tuberculosis. So beta quiline and dilamide, two drugs are used drug resistant tuberculosis. When giving fixed drugs or doses or combination implemented, adult 4 type of band, children's 6 type of bands. For example, 50 to 60 kg one type of band, 60 to 70 kg another type of band available. Like that, adult 4 type of band and children 6 type of band available in the treatment of tuberculosis. Next strategy is ICT tools for adherence and monitoring. ICT stand for Information Communication Technology, as like DOT. So this one like dots. Previously in the Rntcp were using the ICT tools for using information communication and technology, can send message to the patient directly through IVR technology. IVR stand for interactive voice response by phone calls. Give notification to the patient. What will give that notification means as like dots. Person will be there for supervising for taking a treatment. Here we are sending a message or giving a phone call to that particular patient for taking treatment previously, that is called as ICT tools for adherence and monitoring things. We are using communication technology for remembering patient about the treatment. Next, most important strategy, community engagement. We have to engage people, community, all the people. We have to give the IEC, Information Education Communication Technique. We have to give health education. We need to encourage the people to participate that program actively to know the sign and the symptoms of particular disease, and that voluntary self to come undertake treatment. If any person having continuous cough 2 weeks or any other symptoms like chills, fever, weight loss, then patient should have minimum knowledge about the sign and symptoms of tuberculosis. Then they should come the sub center. They will give the samples. How many samples they can give? 2 times samples. First day of that visit, then next day early morning samples has to give. So they when they have to continue 2 weeks continuous cough, they will give 2 times sample. First day visit, second one is next day early morning to the sub center. So this is called community engagement. Next, multi-sectorial response. Need to communicate with the all other ministerial things also. So, with the help of all other Ministry of Health and Family Welfare, we need to good communication with all other department also. What is other recent things means in this program? Incentive revised. So under the National Tuberculosis Elimination Program, we are giving the incentive for the patient and healthcare worker and even private worker also. So we are giving intensive for the patient who is checking for them monthly basic 500 rupees for monthly we are giving. Why we are giving means to assist the nutritional support under the program uh, Niksai Pokshan Yokshana. Niksai Pokshan Yoshana. This program we are giving 500 rupees for financial assistance for that patient, and you are giving financial assistance to the health workers who is notified for him also. We are giving and who is volunteering or monitoring for him also, and private worker also we are encouraging to notify them also giving incentive. There are different incentive are there. Another ICT says Nikshay. Nikshay is the computer-based software application. It is a software for identifying or notifying or monitoring the data related to the tuberculosis patient. Indian government has started a separate software application that is called as Nikshay. This is all about Rntcp. Main aim of this program to eliminate or eradicate the tuberculosis from India by the year of 2025. These are the strategy to be implemented. They started in the year of 2017.